visible? Screen sharing. Let me share the screen.
Yes, ma'am, you are clearly audible. Please carry on.
Sharing the screen right now.
Yes, ma'am, please go ahead because we can hear you clearly.
Yes, sir. 1 second, sir. Let me share the screen. The screen sharing option is not coming. One second, sir. Well, let me share the screen first, sir. Sir, is the screen visible to all of you, sir?
Ma'am.
Yes.
Yes, ma'am, it is visible.
Okay. A warm good evening to all of you, all the honorable chairperson, the eminent dignitaries, the renowned principal and the vice principal, and all the intellectual educators out there. Welcome to this session on autism spectrum disorder in children. Now, before I start this session, I would like to say that each and every one of you out there are excellent in your own skill. So I am not here to train you, but during my session, I would like to discuss some of the facts and figures and transfer little information regarding this disorder. Now, you see, autism spectrum disorder. Now, this autism spectrum disorder has been there for a long time and people was not focusing on them. Now, the term autism, if you can see, this is a very old term and it is used for people with speech disorder. That means these people were treated as an awkward social communicating skill. Okay. Now, this 2013, you see, the American Psychiatric Association, they took that autism under autism spectrum disorder. They made it an umbrella term, taking 7 other diseases together. Now you see, autism spectrum disorder, let's analyze each of this word. Now, primarily you see the autism is generally a neurological condition present in early childhood or adulthood. Okay. Now it is characterized by difficulty in communicating and forming relationship with other people and in using language and abstract concept. Now, you know, communicating skill. Here I want to tell you that communication is simple. Basic communication is verbal communication and non-verbal communication. But you know, this non-verbal and verbal communication is also lacking in these children. And here the term spectrum, as you see, those who are from the science background, they know that spectrum means a band of 7 colors. Generally, you find it when the white light splits out. Now you see, here the word spectrum has been used because 7 disorders had been taken together under this autism spectrum disorder, mainly like delay in language skill, delay in movement skill, delay in cognitive and learning. Okay, then other disorders, you see, these children might show and very much over hyperreactive impulsive or inattentiveness, epilepsy, tremor, unusual eating and sleeping disorders, and above all, gastrointestinal issues they would be having. So all these disorders taken together under a spectrum disorder. And you see disorder. Disorder and disease is an entirely different, but at the same time, they are correlated. Now you see the disorder, the word is disorder. That means something is disrupting. That means it is deviating from the normalcy or the systematic function. Now here, in my next slide, you see, it is written a fragile X syndrome. Now, if a person from bio background, they might be knowing that what X syndrome, or these are actually genetic disorder. And I know if the person is from a gender, not from a bio background, it would be very difficult to perceive. But for the layman's definition, I would like to say that it is some kind of a genetic disorder that can be identified by simple diagnostic blood test. Nowadays, since the COVID situation is going on, that RT-PCR test and all, we are all acquainted with. Okay, so like that, when that genome analysis could be done, that FX factor can be easily found out in the blood test. And if early screening is done, this process may lead to the curing. Okay, early interventions may lead to the curing of that. Now see, this autism spectrum disorder, it can be classified into 3 different levels, or rather it has 3 different levels in autism spectrum disorder. The level 1. See, the level 1, you see, it requires little support. Okay, a little support, because this is a milder version of autism spectrum disorder. And here, the person or the child has got difficulty in initiating social interaction. That means what? As I told you earlier, the communication skill is exactly lacking in this particular child. So the child will not initiate any reaction. Okay, for example, if you say hi to this child, the child may not respond at all, because reactions that later the psychological or the psychomotor failure, what is there, I'll deal it in the next part. But basically the level 1 is a very milder one, but with care, with care or peer interaction, these things can be recovered. The child can be taken up, and proper caring and proper counseling, if it is done, the child can be merged with the mainstream education system. And that is the main motto of NEP 2020. Now, as so many revisions and so many discussions has been done on NEP 2020. One is inclusive education policy is also one of the policies that is there in NEP 2020, where children with special needs, these are actually autism spectrum disorder children, they are children with special needs, and these children with special needs has to be taken and they have to merge with mainstream education system. So that is why if care and proper counseling is taken, and if it is handled well, these children can be taken together. Now, when you go to level 2, you see autism spectrum disorder level 2, these children needs a substantial support. Yes, something happened.
Ma'am, share it again, please.
Now somebody started the annotation and it again went off. Yes. Is it visible, sir?
Yes, ma'am. Carry on.
Okay. Now you see, when we go to the level 2 disorder, it is first it was a milder one, and at this part, it is not a milder version. It is something that requires real practice counseling. You need professional counselors who all are trained to counsel these kind of children, because the social interaction is very limited, and they'll communicate or they'll react to only few people that they are very close to. Okay, social interaction is very limited, and you see a to narrow the special interest and frequent, restricted and repetitive behavior minded, if they are, for example, banging their desk, it is not under their control, and this repetitive behavior is continuously done by them. It is not their fault, but it is the psychomotor failure that creates that. So that has to be dealt, and it is very difficult to merge them along with normal children. And the third one, the level 3, it is a very severe one, because here, the child or the person who is suffering from the level 3 disorder is very, very reluctant to any kind of social interaction. The child will not talk, the child will not express, but on the other hand, the child will show plenty of tantrums. It is very difficult even for the parents to control these kind of a child. So, these children, they are kept in special rehab centers where the trained medical practitioners are there. The trained counselors are there who can take these children. And if they are taken and controlled, and their habits should be trained so that they can lead a common, simple life. Because these autism spectrum disorder children, right from level 1 to level 3, physically and physiologically, they are exactly like normal children. Nothing is wrong, no disease in them. Everything is normal, the body function, the normal life processes. But, the psychomotor failure in them, it's creating a problem in their behavior. So that is why they cannot react, they cannot respond. Now, here it's just an overview. First is how autism impacts activity. Then we'll come to the demographic, then type of disorder, then its etiology or pathophysiology. Then we'll come to signs and symptoms, then diagnosis of lab value, nutritional status, treatment, and nutrition and care. Now here I would like to ask you that if, can you tell me how how does it feel to be an autistic person or an autistic child? So can you please unmute the chat box?
Yes, sir, it is enabled. Yes, ma'am.
Yes, just in 2 words, just tell me, or 1 word, just tell me that how does it feel? How does the child, according to you, how would the child feel sitting in the class, and if he or she is suffering from ASD? Yes, anybody?
Let me see the chat box.
I can see yes, I can see all of you are so active. Yes, exactly. Yes, feeling lonely. Yes. Yes, sometimes angry also. Yes. Okay. Thank you everybody for your response. So I think you all are actively listening. Thank you so much for such an overwhelming response. Thank you so much. Now here, you see, this is the demographic data. Okay. Now you see 1 in 68 children, as from the slide you can see, it is not so uncommon. See, if 1 out of 68, that is the gross ratio where children suffer from ASD. And you see 1 in 42 boys. 1 out of 42 boys you can find suffering from ASD, and in girls, the ratio is a much lower one. You see, it is 1 in 189. Okay. Now, you see, it is 5 times more common in boys. Okay. In India, people are not aware. People are not aware of this kind of disorder going on. But, the Western countries, plenty of research has been done. And, they have really taken out for help. Per family, if you, excuse me. You see, if you see the cost, per family, it is nearly $60,000. So it's treating a child with ASD is not a cheap thing. ASD, if you see demographically, some racial, some ethnic, socio-economic group, the Caucasian group, they are common there. Now, 50% of the children, they have got at least average intellectual ability, and 25% with ASD. Excuse me for that. So, oh, okay. Now, you see, these are the types of ASD. Now, what are the type of ASD? First part, you see, we have the classic autism. Now, classic autism is generally related to speech disorders. Okay, here the child, lacks social interaction, and speech disorder is there, cannot communicate in verbal form. Okay, that's the classic autism as we call it, and very awkward social skill. The next part, when you go, you see it is the Rett syndrome. The Rett syndrome, it is generally common in girls. Very rare to uncommon in boys, but the Rett syndrome is common in girls. And the system, the psychomotor system in them, it is not controlled. The patient or the child, has got very difficulty in doing simple, normal day-to-day life. For example, see, psychomotor means what? What you think. For example, if you want to get up, the brain will guide your body to stand. Okay, so that is a relationship between your brain and your body, control and coordination. But in Rett syndrome, the psychomotor failure is to that extent that the child cannot eat the food from the plate. So you can imagine how pathetic the life is. Next, and these kind of children, you cannot handle in school. So they are taken to special centers or rehab centers where they are trained to normal body functioning or normal day-to-day life training they are having there. The third part, you see, it is the pervasive development disorder. Okay, so this pervasive development disorder is again a very severe form of ASD. Now, this pervasive development disorder, here again the psychomotor failure is always there. The person loses all sort of communication skills, and and the person is not attached to anybody. For example, the child suffering from ASD and this particular pervasive, that means PDD, will not recognize the parents, and you can easily think that how pathetic is the condition for parents with these kind of children, and it is a very difficult situation, and the child is totally, the child does not want to communicate with anybody. Now you see the Asperger's syndrome. This Asperger's syndrome is a very milder version of Asperger's syndrome. As I told you earlier, it comes under level 1, and it can be easily taken up in the normal education system, and children, if nurtured well, taken care of, they can be merged with the normal education system, and they can be well groomed. And these children, to be I want to make it a point here that these children, they are very efficient in mechanical tools. They are very much attracted with mechanics. So these children can become excellent mechanical engineer. If many of you must have seen that picture where My Name is Khan, where Shah Rukh Khan was the hero of that picture. And there, Shah Rukh Khan was an autic person, but he was excellent in mechanics. So these children can be, if groomed properly, can become excellent mechanical engineer or something with machine. They are very much fascinated with machine. The last part you see, it is the childhood disintegrative disorder. Now, what is childhood disintegrative disorder? It is taken to be one of the severest type of disorder under ASD, and it is also known as a Helen Keller syndrome. What happened? Helen Keller, if you all know that in her early childhood, she was just like a normal child, just like any other normal child in the society. Then, some condition, some diseases, some illness or fever was she was affected with, and then after that, suddenly the body starts degenerating. For example, the muscle loses its power, even the visual perception power, the visual, the auditory, the speech, everything, gradually degenerates, and even the toilet habits It's very difficult for these children. And these children are also, you cannot take them together in a normal school. These need special trainers, special medical supports also they need, because they can show any amount of scissors, they can show any amount of epilepsy trainer, because that is very difficult to provide at a school level. But you see, at the end of the day, who Helen Keller, nobody knows that such a child will become a Helen Keller. So they can, you never know the future of the child, isn't it? Now here you see just a case study. You see, it's just taken to just show how it feels for parents and how it feels for the child. It's a case study of two brothers. One of them is named as John, okay, and he is just a normal child. And the second brother, John's age is 2 and his elder brother is 3.5 years. Okay. Now John grows up to be a normal boy, but this, elder brother is becoming, normally he was okay. By the time he came to the age of 3.5, he was okay. Then suddenly his behavior becomes erotic. Okay, now see, sleep disorders are always there. So frequently he wakes up in the night screaming, crying inconsolable, because the child does not know what's the problem within. So obviously he will be howling and he will be crying. And if such a child is crying, if the child does not know what is the problem, so he would be inconsolable. Okay. Then after a few months, see, he was going through degenerative disorders. So his condition was worsening. First, he showed a steep decline in communication skill. He will not, even eye contacts also, they will not make. They won't even look at you if you are calling that particular child. Then repetitive behavior. See, he begins to flap his hand. He will keep on flapping his hand without reason to soil himself. See, toilet habits are all gone and he loses all interest in social interaction. Extensive medical examination was conducted by 2 pediatric hospitals and failing to reveal anything that might explain the regression. Now, I told you earlier also that these children, physically and physiologically, they are okay. There's nothing wrong to it. It is the disorder in the brain that is happening like that. Then, apart from an occasional signal and word, he was placed in special schools for severely disabled. So these conditions, you cannot handle in school, but you have to take them to special medical practitioners for that. Now you see, it is the etiology. Now maybe what are the causes? See, genetic disorders may bring about, any change in the DNA sequence may also bring about that. Vaccines can also bring about that. Brain connections and growth, it may also bring about that. Okay, now some processes, some failure in the brains are all like connection bases, neurons, nerves, they are all connections like electric wirings. So somewhere if the connection goes wrong, you never know what is within. Then immune system, some environmental factors, and serotonin level. Now, what is serotonin level? Serotonin level, actually, these are feel-good hormones. Feel-good hormones means these hormones are there. For example, if you are happy, the serotonin will make you happy. Then if you are sad, the level of serotonin goes down, you will be sad. Then sleep hormones, that is melatonin, like that, it goes on like that. Okay, so these might be, see, nothing is fixed. So these might be one of the causes that may lead to ASD. Now see, this part. If a person is suffering from ASD, as teachers, what is our responsibility? First and foremost, you have to respect the difference in the child, because every child is unique and every child is differently able. There is no single child on this earth is there who has no good qualities. It is our perception. How do we see it? How do we feel it? And the second is, you have to treat, first you have to respect the difference and you have to treat that particular child with empathy. It is the only empathy and care that you and only you have to give. Because teachers, as teachers, we know we are very possessive about our children. Any class teacher you ask, And every class teacher knows that particular child. Why? Because the class teacher always understands their children, isn't it? So that is the reason that before you are treating somebody or some children with ASD disorder, you have to first find out that is that particular child having some disorder. So you have to accept. You have to accept the fact that this child is different. Then you have to understand that what type of difference is this child is having, and then you have to assess them according to it. Because if you take this rote learning method, simply that classwork, homework, and like that, so that way you cannot judge these kind of children. And nowadays, with the powered with NEP 2020, everything has become flexible. The teaching procedure has become flexible. The assessment method has also been flexible. So you have to treat and you have to understand, and it is only you who can do that. Now you see, here in the first point, you see, you have to learn about the way autism shows up in this particular child. I told you there are different ways and different levels. Okay, so you have to particularly see that what is the deficit or what type of autism this particular child is having. Then you see, if you are handling that child, your communication skill should be clear and distinct. Your communication skill should be clear and distinct, because you have to teach the child clear communication skill for getting their wants and needs. For example, if the child wants to eat, he or she will directly communicate you, and you are going to just provide what the child wants. So those needs, wants should be very distinct, so that they can communicate with you. Okay, then they don't like changes. For example, someday if you think that today in the classroom we'll not take classes, we'll go to the garden and we'll take the class. But it would be normal for all the other child. But these kind of children will never be able to accept the change. So you have to be calm. You cannot reinforce any accidental changes behavior. Okay, so you have to calm them down. You have to make the child understand, and you have to give the child their own pace, their time to react. So you have to give them that. And if once they are well adjusted to you, they should feel safe. Okay, once they feel safe, you see, your communication will be much easier to them. Then again, I told you to be aware of changes and communicate regularly. For example, suddenly if you change the seat of that particular child, you said, okay, you don't sit here, somebody else. Even if you change the partner also, the child may feel confused, unsafe. So he or she might show any amount of reaction. He might cry, he might vomit. So you have to see to that. And sometimes when you have to impose something, you can, but make it as a last resort, and make sure that they are not reinforced a problematic behavior. For example, if you change the place, or if you let the child forcefully out for the assembly or force him to go to the ground, he might show tantrums, but you have to make control of it. You have to see that if this disorder happens, this change happens, so this problem was there. So you have to judge and you have to see. Now you see, you have to map the daily activities. For example, you see, whenever a patient is admitted in the hospital, whether the patient is suffering from fever or not, they get a regular checkup of fever like that. So, time to time, you have to map the development, you map the happening, whatever the habits of that particular child. And you have to make proper connection with the parents too, because counseling the parents is also very, very important. See, you have to make sure to record what happened right before a problem behavior and occurred, and what was done after that. That you also should keep in mind that this happened, so the child was howling, or the child went into seizures or had epilepsy tremor. After that, when this was given, the child was again back to normal. So it is you who have to do that. Now, collaborate with other people in the child's life. I told you earlier also that we have to make sure that parents are also in direct communication with us. Because whenever you want to report something, sometimes, a minor change in the habit or a minor sickness also may create something big in the life of the child. So the parents are to be informed also. And India, it's very disheartening that India, these kind of children, they are simply marginalized and kept at the corner, because sometimes, children, they form, it is a status symbol also. See, if children are well educated and well groomed, and if the child is very smart, the parents will be make it sure that whenever they are going, they'll be telling, they'll be patronizing their child every time they'll go. But once, they find that this child, they feel that it is their shame. It is a shame to have that kind of child along with them. So that thing should be counseling should be done at that level, so that at least the child should feel him or herself safe in the company of the parents. Then you see, again, make sure that the child's behavior plan is consistently implemented across setting. That means whatever change you want to make in the child's behavior, you keep it a constant record to it. Now you see, whenever we are in the class, how to identify this particular child is not normal child. How do we do that? Normal means, see, suddenly in a classroom, it takes time. It takes time to find out that this is not a normal child and this is a child with special needs. Because sometimes, normal child also, they show such kind of tantrums, especially in the kindergarten, that it is very difficult. They also don't eat. They also sometimes cry, howl uncontrollably, like that. So, how do you detect like? Now you see, inappropriate playing behavior. For example, if you have a group of children playing a particular game, now this particular child will have a different pattern, or he will be isolated from the other and playing in a very different way. Then, inappropriate laughing or crying. Sometimes if all the boys are laughing at something, you might find this child suddenly crying. Or when others are studying very seriously, this particular child may suddenly start laughing. So you have to see to that. And sometimes strange attachment to objects are also there. So you have to make good use of that. I said some children, suffering from ASD, they are very much attached to machine tools like that. So, for example, here in the slide, you see that child is smelling the leaf. So that leaf must have the child must have been attracted to the leaf. So that you have to see that what is the special interest of the child. And you cannot do that alone. I'll come to that. Here you have to do multidisciplinary team. For example, if you are handling that child, you have to find out that whether, see, music, art and craft, okay, drawing, painting, dancing. These are the things, that might be one of the positive side of this child. The child might be easily attracted to that. So you have to see, and you have to cater to the child in a very special way, because his speech, he has got a poor speech or poor communication skill. You have to see. And these children are sometimes very hyperactive, or sometimes they'll be very reluctant, but don't think that they are adamant. It is the within difficulty, it is the some inbuilt difficulty within the body that is creating that. Okay, now you see, I said they are oversensitive also, and sometimes they may harm themselves. You have to see, because psychomotor failure is there. So you have to watch them when they are in the garden. You have to watch them when they are climbing down the stairs. So you have to make that, and that peer counseling, peer interaction, peer group interaction, here it can work wonders. Okay, and make sure that whenever you are dealing with these kind of children, they are hypersensitive, and sometimes if you raise your voice, for example, if you are a class of 34 to 40 children, at times you may need to raise your voice. Okay, so when you need to raise your voice, you may be very cautious, because even if you are not scolding that particular child, the child may feel a sense of insecurity and might give a different reaction to it. So you have to see to that. Now here, these are the some of the symptoms, the child will be showing. For example, I said that the child will definitely avoid eye contact. For example, if you are calling the child by the name, see somebody, Ashok Yadav, he's scribbling on the presentation. Sir, please, we all are teachers. Please don't do that. Now, avoid eye contacts, because the child will not respond to you. Even if you call the name, he will be in his own world. So you have to see to that. And when small children, they are very happy when the teacher gives them a hug. But these children might start crying. If you just call him to your side, they may not, because they avoid or restrict physical contact. So you cannot do that. So once you have created a rapport, then that cuddling they'll allow. Otherwise, you will not allow. And the facial expression also. Every time the child will have a flat or an inappropriate facial expression. Whether he's happy, he'll have a same facial expression. Whether he's sad, then also he'll have a that kind of a facial expression. So you have to see to that, and you should understand and accept that he is like that, he or she is like that. Okay. And sometimes he may not be in a mood to talk to others, he may not be in a mood. For example, you want some kind of activity. For example, you are having a drawing class and you want that the child should be painting, so he might throw the colors away, because if he is not in a mood, he'll not do that. So you have to accept that. You have to accept these and you have to act according to it. Now see, here again, that delayed response to name. When you are taking the class, you have to see that this communication skill, they are lacking in that. So they will not respond to their names being called, and sometimes they'll babble off, because they will babble off. That means they might be trying to say what you want to hear from them, but the speech that comes out, so you have to adjust to that. And as a social behavior, as I told you earlier, that these children are very, very lonely within, because they are not friendly to themselves also. So you have to see that these children with autism spectrum disorder, you have to be to their shoes to know how it feels like that. And that repetitive behavior is also there. Okay. Repetitive behavior means if the child is clapping the hand, if the child is clapping the hands, or if he or she is banging the desk, you can change that, because it is the compassion and empathy that is the only thing you can give them. Okay. And other physical and medical conditions, that as much as in the school limitations you can handle, but beyond that you cannot handle. But at least you can make the parents, you can counsel the parents, so that they can be taken to the given proper treatment, or taken to the proper rehab centers where they are given habit therapy, like that. Now, when do you actually diagnose this? The diagnosis of these disorder, as early as the age of 2, this autism spectrum disorder can be diagnosed. Okay. Now, there is, as I told you, no confirmed medical test still now is there, where you can identify this, that okay, this particular child is suffering. So there is no confirmed medical test. So you have to take little slow, and you have to understand the proper type of disease. Then you see, I told you that multidisciplinary team. So multidisciplinary team, can work wonders. If can you name a Hindi movie, in this Bollywood movie where Amir Khan had a student. Okay. Amir Khan had a student, and he had dyslexia. He had a problem in reading. So he was very tough on maths or English or something like that, since he was unable to read, he was unable to write. But here, he was given a special treatment. Drawing he was given to, and he did wonders. Can any one of you tell the name? Write the name in the chat box. Yes?
Yes, ma'am. It is there.
Yes. Tare Zameen Pe. Yes, that is the name of the picture. And the name of the boy was Ishan Avasthi. Ishan Avasthi was suffering from dyslexia, and he was unable, because dyslexia is also another disease, that comes under early childhood reading and learning disorder. Okay, the person shows very delayed learning. Why? Because whatever he sees in front of him is the mirror image. For example, in the screen, multidisciplinary team. So we are reading it from left to right, but the child will be reading it from right to left. So it is very difficult for them. The perception of the word, it's very difficult. So, this multidisciplinary team can work wonders, and it can work like magic to these children. Okay. Now you see, these children, some of these children have got hearing difficulties also, hearing and vision. I told you, and infantile glaucoma. Infantile glaucoma is another disease, when the child is unable to see. And gradually, as the child grows, the vision goes off. So that is also another part, and is taken together. See, child vision also goes down, and hearing impairment happens side by side. So it is a very difficult position, and it happens when the degenerative disorder is there. Normally the child is normal in the early age, but gradually when the child grows in age, these things happen. And sleeping difficulty testing that you cannot do in the Putul Saha. Please. Okay. So that also they can be done. Okay. So these are some of the tests, you have to observe. And another English saying is there, you understand a lot by watching. So as teachers, our duty is to observe the child. Okay. We have to observe, and then we have to react to it. Now see, treatments, medical treatments and all the pathological lab tests, I will not deal into it, because those are done by the medical practitioners and all. At the school level, we cannot do that. But early intervention, if the child is detected early, proper medical treatment is given early, and the parent counseling is very, very important. Okay, so that if it is done at a very right time, these children can develop into normal one, because proper habit counseling, if it is given, they can come back to the normal phase. Okay, behavior and communication approaches. See, behavior and communication approaches, you have to train. See, if there are special trainers, special counselors are there who can counsel the behavior. Okay, and they can communicate to them. And again, the dietary approach is also very, very important, because whatever is beneficial, if it is given to that, the child will be well groomed. Okay, then complementary and alternative medicine and parents counseling again, because every time, earlier also I said, you have to keep a record, you have to map the behavior. This happened due to this. So these are the simple, very simple techniques, when you are dealing with these children. And above all, that empathy, I said, that compassion, that has to be there. See, nutrition process, and you have to keep in mind that each child is unique. Every child, they are specialized in a different way. See, we call it children are differently able. So differently able means that there are disciplines where the child is able. They may be masters to it. So it is our duty as teachers, as mentors, to find out what is the particular uniqueness hidden in that child. So that way we have to create a rapport. We have to create a discrete communication skill with the children, so that the child and you understand. Let the others don't understand, it's not a problem. But the child should be communicating with you. The child should be safe in your presence. So that has to be done. And again, the multidisciplinary team has to, we all need to collab together. Different disciplines, the art, the music, the drama, the dance, everything together, collaborate together. And then the child will find interest in any one of this. And if the child finds the domain where he is interested in it, he can do wonders. Okay. And the magic begins then. Then additional genetic disorder, those you cannot, you can find the family history. If somebody is having this disease, it might be heredity at times also. And some schools, they provide lunch or tiffin to the children. So when they are providing lunch and tiffin to the children, there are special dietitians who simply plan the meal to give these children. But if in schools where children bring tiffin from home, there the parents can also be counseled or motivated or make them understand that what is good. See, gluten-free and casein-free diet is the best support for these children. Okay, so you have to do that. And then, the other thing is the child should be made as comfortable as possible throughout this process. The child should feel safe in your presence. And finally, you have to understand that children, autism, they are always unique. They are totally interesting and sometimes mysterious. So I think this is the last slide, and I think I have come to the end of the session. Sir, can I have a few words from you, sir? Jubunbo, sir.
Yes, what do you want to say?
Sir, can I have a few words from you? I have come to the end of the session.
From me?
Yes, sir.
No, actually, now Mr. Bhaskar Rao will say something in favor of you. But time is 10 minutes in your hand. If you want the question from the chat box, that you can.
Yeah, yes, sir.
Go to the chat box and take few questions and give their answer.
Okay.
It will be better.
Okay, sir. If anybody has a query, please, you can write in the chat box. I'll answer that. Yes, anybody with a query? Yes, what is gluten-free diet? Yes. Now, gluten-free diet, gluten is a type of a protein that is found in the, wheat. It is gluten-free, but rice is not gluten-free. Quinoa, these are all gluten-free diet. Yes, casein-free diet, that means the milk and the dairy product is the casein-free diet. Genome sequence, actually genome sequence, it's a study where the genetical analysis has been done. That means hereditable characters, the characters that is inherited from the grandparents to the parents and to the offspring. How can you identify an autistic child? See, you have to identify, it is your observation. The child, first and foremost, you can see that speech disorders, if it is there or not. Then in other sense, you can see that communication skill. Sometimes, sometimes it is curable. Obviously, it is curable. Yes, thank you so much. What chemical takes place in the development of child? Actually, it's a chemical. See, serotonin is the chemical, If the level goes down, it's a hormone. I said feel-good hormone, and all the activities are coordinated by that. So if that level goes down, it will create a problem in the child. How to convince their parents? Yes, how to convince? This is also a very, very important point. You know, that convincing the parents, especially in India and especially in our locality, it is very, very difficult. But at the end of the day, we are teachers, you know, we are all smart at our own field. So if we think we can convince, we'll definitely convince them. Yes, very informative. Thank you. Yes, how to handle this in school? You know, some of the disorders, if they are at level 1, grade 1, we can already handle. We have to handle that, these children. But again, you know, you have to take help of the counselor. You have to take help of the multidisciplinary team. You have to talk to the principal, any changes you want to make, and you have to report to the parents also if any discrete or any sudden behavior you find in the child. That has to be done. Otherwise, you cannot handle them, because it is a very difficult on your part as well as on the parents' part. But it is difficult, but it is not impossible. What is the main reason? See, till now, clinically, any specific disorder, any specific problem has not been located. The reason for this particular problem has not been located. So, but you know, some genetical disorder, some vaccines, some immune system disorder can lead to this. Your question shows that how interactive you all have been. Yes. Yes, any more question? What is the how to improve the mental health? See, mental health, first and foremost, you need to train that child, you know. Special training through counseling, you can train them. How is autism caused? You know, I have already dealt in the earlier part that and Asperger's one, you know, that is the common one. Asperger's is a very common one and a mild at grade 1, and you can handle it in the school level. Only the communication skill, if you work on it, you can already do that. Now, what is ASD? ASD, the full form of ASD is Autism Spectrum Disorder. Yes, autism goes away. See, in 80% cases, if proper counseling is given, you know, they can go away, but sometimes it will not go away. Yes, yoga and meditation can help the child, because yoga and meditation is a very safe way to control the brain, to focus them. Definitely yoga and meditation can be done. Rett syndrome, you know, it is a very common syndrome. Not common, I would say. It is a syndrome generally found in the girls. Commonly in girls, boys generally don't have this syndrome. And here, you know, the psychomotor failure is there. And due to the psychomotor failure, the child goes into seizures and epilepsy tremors. So it is very difficult. Yes. Which parents are responsible for autism? You know, sometimes parents, if they are carrier of FX is a particular defective gene, you know. If that the parents are carrier, so that may be inherited by the child, and the child may get autism spectrum disorder. Yes, if you find this session informative, thank you so much. What should be the role of such each parents? Yes, the role of parents is immense, and I really, my heart goes out for those parents, because taking, grooming an autism spectrum disorder child along with a normal child, in the first place, it is expensive, very expensive. And secondly, you need the parents needs counseling and patience. Parents sometimes get frustrated, handling that has to be gone away. Yes, about the link, I have nothing to do with that. When the time will come, link will be shared to you. Yes, everything will be shared to you. Yes, sir. Common autism screening tool. See, screening tool, I told you there that in one of my slide I had shown you that child will not have eye contact with you, then the lack in communication skill, both the verbal and the non-verbal one. Yes. Yes, for the attendance link and also will be giving. Asperger's syndrome I had dealt earlier also. It's a very milder level 1, and you can deal it in class, in the common classroom. You can deal this, and yes, main thing, the teacher has to be passionate. If you are in this profession, and passion is there, you can do everything. You can do everything. Yes, autism can be caused by trauma. Sometimes, if any sudden shock, mental shock, the child has gone through. So they can have this kind of a disorder.
So, madam, thank you. Now, for the conclude part, Mr. Bhaskar Rao is there, Principal Don Bosco Ramkanali. Are you there?
Yes, sir. Yes, sir.
So it is your part. Before you come up, I have to say a few lines to the all teachers of all Sahodayas. That is, chairmen, my dear chairmen, you are hereby requested to ask the concerned principal and teacher to give the proper mail ID to our IT department so that we can send it in very properly. Lot of mistakes are coming only due to not proper mail ID. So kindly rectify it and do process it, please. Now, Mr. L. Bhaskar Rao, you conclude the program, and thank you all. And after your conclusion, I request Mr. Pradipto Mukherjee and Mr. Pranesh Solomon, Chairman of GODDA DUMKA JAMTARA, to speak something. Yes, Mr. L. Bhaskar Rao, please hand over to you.
Am I audible, sir?
Yes, you are audible.
Okay, sir. Myself, L. Bhaskar Rao, Principal of Don Bosco Ramkanali Nirsa, Dhanbad. I would like to say something about the vote of thanks today evening. On behalf of Jksm Memorial Sahodaya School Complex, Dhanbad, I would like to thank Chairman Mr. T.K. Sinha, Vice Chairman Mr. Basudev Mahato, and our mentor Mr. Jubin Bose, Principal of SGD Modern School, Chirkunda. Frankly speaking, today we are witnessing the in-house training program because of these two people, Mr. T.K. Sinha and Mr. Jubin Bose, who tried a lot to bring and to organize the in-house training in this belt. In other words, it can be said that this Chirkunda belt has become Dhanbad area, and because of their hard labor, most of the schools today are getting the in-house training program. This is a fact. At the same time, I would like to thank all Sahodaya chairpersons, principals, STNCs, and teachers who have given their precious time for today's in-house training. And at the same time, I would like to appreciate the resource person of today, Madam Sanchita SRIVASTAVA, STNC Kids Garden, JHARIA. Once it was felt by me that I was not doing the training of in-house, but I was a student sitting in a classroom. The session was so much interesting, and she revealed too many interesting facts that I think it will be helpful for every participant to use in their profession, in their day-to-day life. At the same, my gratefulness to Vikram sir, also Vice Principal of Valley Public School, Patlabadi, and another person is there, Mr. Surajit Sen, DDTC, CBSE, as well as the Principal of Jharkhand Public Schools, Baliapur. I would like to extend my thanks to the technician team also, and all the participants, those who spared their valuable, precious time for this today's in-house training program. I would like to thank everybody. Thank you very much. And before concluding, once again, I appreciate the hard work of Mr. Jubin Bose and Sir TK Sinha. Thank you, sir. Thank you very much for your hard labor to organizing such programs in our area. Thank you very much.
Before feedback form, once again I request Mr. Pradipto Mukherjee, Chairman DUMKA JAMTARA. Are you there, sir?
Yes, sir. Yes, sir.
So,
Many thanks to today's trainer Sanchita SRIVASTAVA madam. Today's training is also very useful for us. Thanks to TK Sinha sir, Jubin Bose sir, Arvind sir, and entire technical team. Thank you, sir.
and GODDA DUMKA SAHEBGANJ.
GODDA SAHEBGANJ, Pranesh Salman sir.
Mr. Pranesh Salman. Are you there, sir? No,
No, sir, I think he is not here.
not yet. So it is hand over to you, Arvind, now for the feedback form. And good night to you all from Jksm Memorial SAHODAYA School Complex, DHANBAD. Good night to you all. Thank you.
Thank you, sir.
Attendance link is given. Please participant fill it properly.